I was generous today, and I already have gowns up there for you.
Oh, sure. Sure. I'll wait till the third.
But you can open up your gloves. You can open and grab the doctor's gloves too. You're the doctor, so you just can sit there. Patient, lay down.
So I'm the scrub tech.
You're the scrub tech, so you better get scrubbing. Scrub tech, ortho tech, doctor, and nurse. Nurse. Ortho tech. You guys got to get your gloves up, ready to go. And then you got to get the patient ready. Patient's asleep. You're doing carpal tunnel syndrome release. Nope, let them do everything. You just lay there. You're good at that.
Oh, wait, you have Mr. Fantastic. Great.
Do you want to do your intro?
What's up?
Your intro?
My intro? Do I do intros?
Yeah, you always do an intro.
Oh, carpal tunnel surgery, surgical room preparation. Take one. Oh, this is
Can you find me a extremity drape in one of those closets?
Chris? Don't they do elbow surgery and pronation too sometimes?
Well, in pronation, yes. But I mean, I can do a pronation right here. She's in pronation right now. Sometimes we'll do this.
Yeah, pretty sure the body itself.
Sometimes we do like a messy lateral. Yep. And you need the thing to scrub him. Ortho tech can't be scrubbed right now. The scrub tech gets scrubbed. You gotta get patient ready. What do you need? Doctor, what are they gonna need? Your patient's sleep on the table. What does your ortho tech need?
I don't know. I'm busy texting.
Yep, we need one of those. Bring that out. Open that up sterilely. Probably in there. It's right there.
Did I say that? I should, huh? I don't want to be like too specific.
You're gonna need overall. You need overall.
You don't know?
Somebody needs it ain't gonna be me. I'm not in the room.
That's the term. The drape is in there.
Come on. Fingers down, thumb towards you, thumb down. Okay. Supposed to be pulling the cuff over. So we're gonna do an axillary tourniquet all the way up, all the way in the armpit. the custodian came in to help out.
He's in the custodial What a gentleman.
He just walked in at the wrong time. He was like, oh, just kidding, I'll come back later.
Not me. Just because you're not still doesn't mean you can't do it, right?
No, you hold the type of look.
Very good. Are you done with that? Look at that thing is falling off of him.
Put this on.
Someone help hold his arm up while she puts that thing on there.
Sides up.
You're gonna have to sucker way up in his armpit. High and tight. Remember? We talked about that. So she can hold the arm, and then you're gonna come up here and. You want these up. There you go. You're gonna pull this tight. Okay, she can do it. She gotta do it. She gotta do it. And then that ties the knot. Is he doing that right, doctor? So what can you do now? What else do you need to do to this patient before he goes before you operate on him?
Put padding on your head.
Yeah, make sure the padding's in there. I had some felt already cut. Could use felt. It's up to you. That needs to be propped up so that you can wash it. So what can we use to prop his arm up? You just need something underneath here.
Abduction pillow?
You can use a pillow. It doesn't have to be even soft. It's very temporary while she washes. She's thinking. Nurse!
Yeah.
You don't wash your hands.
Oh, is that it?
You're not scrubbing. You're doing that.
Yeah.
You and the doctor go scrub now, right? Everything's ready to go?
But I don't have to wash before I glove myself.
No.
Oh.
You just put those on sterilely. Figure out a way, make sure you gotta open that up too. Come on, doctor.
It's a little cold.
I'm impressed so far. I'm liking what I'm seeing. You're not yelling a whole lot. You might actually have your voice. I'll get it. Or you can get it. Did she drive?
Yeah.
Didn't we have someone hold the arm last time?
Don't you do your hand first before you touch it?
She can. You can put a little bit on your hand if you're holding,
Yeah.
but she's not. It's holding itself.
Oh.
So the only time she's gonna lift that arm up is when she starts getting down here. Don't forget the hand. Before you're working too far down. There you go. Nope, you gotta force it open. In between the fingers, get it all.
I don't get it on
For the hand, do you just scrub all the way up to the elbow, or is it more?
You go all the way to the pit.
Okay.
Are you gonna arm a little bit?
She didn't do that on her. You can't go out of the room and have someone tie you up. What was that? You were perfect. Everything was fine.
Touch you.
Thank you.
Your nurse is a little slow scrubbing. That's okay.
Dude.
I'll take it. Don't throw that one. You can lay it, just let it, it'll hold itself on it. Yep. There we go.
Can you tell me?
I'm like, this is trap.
I know, your nurse has got to do it. But she's fighting an arm. There she goes. No! Don't know!
You just, oh, okay, I forgot she's first. Okay.
And you were going to listen to her. Okay, I'll tell you. If you're not sure, don't listen to her. Someone else who's not sure. How'd you get that time?
This?
Yeah.
I said it. You have to hold it. You have to hold it and I'll turn.
Who spun you?
She did. Lizzie said. And then I took it and then I tied it.
After she tied you up?
She tied me up after.
Yeah, there was something screwy going on. If I'd have cut, What's next? Come on. What's next? What do you guys gotta do? Scrub head's just hanging. Drapes, what do you need first, doctor? Come on, call it out.
Down, right.
No,
Split
The stocking.
no.
Stop.
Yeah. That and the down drape.
Wait, man.
You can do whatever you want. You're sterile. You can touch a back table. If your scrub tech's not getting us the right stuff, get that stuff going, scrub tech. What's the first part? Where's that going to go? Where do you think that's going to go? It's going to go on the table because that's where you guys are going to drape. So you don't want, I don't want your gown rubbing up on the table. So you guys are focused right here on the table. But someone needs to grab the stockinette on the hand, Orthotech. Yep. Grab the hand through there. Very good. Get that arm up. Now someone's got to get that box out of there. Who gets the box out?
Nurse.
Very good. Now that comes down. So she can stop contaminating herself. Underneath it. Cover the whole damn chair. Sure. There you go, there you go, there you go. Good. Perfect. Good. Now you can get closer. What's next? Yeah. Roll it down right over top. Yep. No. If it fell, don't worry about it. Remember, if it's below that back table or the navel, let it be. No, you can't do it now. It fell over. You wanted to try to get this over this so that you could put his arm down there. Still a little bit of a struggle. No different than really the elbow one, right? The hip is now going back to when we first did shoulders, so the next group's going to struggle a little bit more because it's not as fresh as, say, this one is. Then we'll go back to extremity when we do knee. But, you know, to be honest with you, this wasn't that bad. This is where I start getting really frustrated with you guys because I feel like, okay, we just did this last week. No reason why we couldn't do this spot on, okay? Besides some fumbling, just getting the patient ready, I don't think it was that bad. Had you tied her up, I'd have crap my pants. But other than that, I think that my nurse did a great job. I think that everybody else did a decent job. Not saying that anybody was bad, but you know, there's a lot going on. There's a lot more than just putting on a cast or a splint or going up and scrubbing your hands and going, okay, I'm ready. You know, a lot more to that. Most of the time, so for instance, right now, I'm working the weekends and they have me training some of the new people, and some of what I see wrong, what they're doing, is they all know how to scrub their hands. They're all very good at getting sterile and draping and doing all that. But the actual part of assisting is where they're really weak. And what I mean by that is they have to anticipate. If you're sitting there, it's just not a good assistant. If you're just sitting there like this, you are of no help. None. When I'm in surgery, I can't stop. can't sit down. I can't sit still. I'm holding the skin open. I'm dabbing the wound. I'm sucking blood. I'm sucking smoke from them coagulated bleeders. You know what I mean? I'm anticipating where he's going with his incision. Sometimes we're making big incisions and they're dissecting down in multiple different planes in multiple areas of the incision. So therefore, I'm holding a retractor on this side and holding a retractor on another side, or I have to guess where he's going. And the doctors like that. They like to see you try to anticipate. Now, I can't anticipate perfect every single time. I could be with the same doctor for years and still on certain incisions, you know, I can't get exactly what he's doing every time. But I could get pretty darn close. But being able to anticipate. Now, that only comes with experience. But just FYI, as we start getting a little bit closer to surgery, all you're going to be doing is this. You know, and you're going to see one of us constantly moving around and assisting, and that's where we want to get you. But I understand it's hard. Just draping alone sometimes it can get pretty tricky. I get that. I'm not, you know, my whole goal in surgery is to get you guys scrubbed in and dabbing blood, sucking blood, you know, maybe holding a leg, doing something, but just standing there, you know. Now, have I had students throw stitches? Yes, I have. Have I had students tie? Yes, I have. So, I mean, we're going to practice all this stuff too. In the next couple of weeks, we're going to start doing suture ties, how to tie by hand, and then we're going to bring in pig's feet and how to do suture skin together. Now, granted, can you suture skin? There is a gray area there whether we can do it or not. Kaiser doesn't allow us to actually pass the needle, but they allow us to tie. And when you're dealing with a big incision, I can close a wound. If the doctor's tying or throwing the stitch and I'm tying, we can close in way faster than if you were trying to do it by an instrument tie. I'd probably say we could close a big wound in like 10 minutes, whereas you try to close that with instrument ties, a single person, and you're talking an hour to close the wound. I'll tie 40 or 50 stitches in that time. So again, stuff that you're all going to be exposed to when you'll see it. All right, let's clean this up, Joel. Good job. Not bad.